Thank you so much and good evening. I am Commissioner Sam Eigner-Trewergy, and I am very pleased to have an opportunity to be with you this evening and to share some important updates and connect with you all as we head out of the state of emergency and into the summer. Our first time also hosting a conversation with the commissioner from our new Boston office at 50 Milk Street, and excited to have to invite you all here as soon as it is ready and open for guests. It really has been quite a challenging year for everyone, and there have been just so many changes happening in such rapid succession in recent weeks. So it seems like such an important time to catch up, share information, and really to look ahead to the summer and beyond around what we can expect as we head out of the state of emergency. We have so appreciated all your input and heard your feedback through our social media and Facebook and Twitter, your emails to the commissioner's inbox, and through our engagement sessions we've held over the last month. Many of the answers to your questions have been incorporated into this presentation, but if your question remains unanswered or you have additional clarification, please submit it through the question and answer feature at the bottom of your screen, and I will try to answer it through at the end of the presentation. Please note, I won't be able to get to every question. So if I don't get to yours, the team will try to point you in the direction of resources to help answer your question, or if it isn't available, to follow up afterwards to make sure that we are getting all of the information that you need to support the services you're providing. We know that this has been such a challenging year for everyone. Early education and care providers have been truly the heroes of your communities and a really critical support to families throughout a tumultuous and uncertain times that COVID-19 brought us. I continue to be so inspired by each and every one of you serving children and families and supporting your communities every day. At EEC, we've worked hard to try to be responsive and collaborative, but have continued to be so impressed by the grit, the perseverance, and your continuous commitment to providing the joyful learning experiences for children and the support families have needed throughout this really complicated year. As the Commonwealth continues to reopen, I am personally very excited to start visiting programs again. This is certainly one of my favorite activities, and I did not make it to nearly enough programs before we had to shut down and really think about health and safety first. So I am very excited to start to come back out, see you all in action, and really have a chance to say thank you in person for all of the work and for all of the support that you provided throughout the last year and a half. As many of you know, the Baker-Polito administration did lift the COVID-19 restrictions on May 29th and ended the state of emergency on June 15th. We are working very quickly to provide updated guidance and information and support to you through this transition. As you know, we have retired the minimum requirements for health and safety and the COVID-19 childcare playbook with the end of the state of emergency. We have tried to create some suggested strategies for the prevention and response to COVID-19 in EEC programs for our programs to continue to understand best practices and strategies they can put in place in order to ensure that your environments can continue to be safe during this time. We put these up on our COVID-19 resource webpage where you can quickly provide relevant updates as you yourself are making decisions and respond to your questions as they arise. But we will continue to send regular updates through the commissioner's update email, and you can find links to guidance and policies and critical transition information through those emails. We're going to put 2 QR codes on the screen right now. You can scan the one to your left to be able to take you to the web page with the suggested strategies, and on the right to make sure that you are subscribed to the Commissioner's email updates. While these are the best resources for all the detailed information, I wanted to highlight some really critical pieces of information. To support the smooth transition out of the state of emergency, we are creating licensing policies that can guide the return to EEC's pre-COVID licensing regulations. Please remember that we no longer will be functioning under minimum requirements or the COVID playbook, and instead returning to our full license, guidance. While we are still, we will be communicating these later this week. We will have all of our materials in one email going out later this week to everyone, pointing you in the direction of all of these changes. I wanted to make sure that you knew a few critical pieces of information in preparation for that email. First, please remember that programs can operate at their full license capacity and ratios, just as you have been able to since the fall. There is no longer a 42 square foot requirement for center-based programs, and you can return to your regular square footage outlined in our regulations. For those of you who have been under an approval to waive the 42 square foot requirement, you will get an email at the end of the week confirming that those restrictions and those parameters are no longer a requirement for you to function under normal licensed square footage. There are also some upcoming changes to the family child care that are tied to the end of the state of emergency as well. As EEC is no longer has the authority to put in revised regulations, we want to remind you that children younger than 10 who live in the residence for a family child care and are present for more than 3 consecutive hours on each of 5 consecutive days will once again be considered to be in the care of the family child care provider and count towards their capacity. We know that many providers have already solidified their enrollment for this summer and have used our COVID guidance to make sure that they were following the right ratios and group size. EEC has developed guidance on obtaining a variance for this requirement that will be available through the end of the summer. More information on this will be released in the next couple of days, but I wanted to give you a heads up that providers who would like to obtain this variance will be able to do so through LEAD, our licensing database, and will be allowed to have that in place through September 15th. So you should plan for your fall enrollment with that in mind, but much more information and many more details coming out in our email later this week. In addition, we will continue to put in our expedited childcare licensing transactions and defer our licensing fees. And that includes for programs opening for the first time, as well as those who want to make shifts in operations. I really want to address specifically the workforce shortage. It's one of the biggest pain points that we have heard for so many programs. And across many industries. We are working as we work through the state of emergency to reduce as many barriers as possible for programs to recruit and retain educators and serve children and families across the Commonwealth. For this reason, we are looking to simplify the requirements pertaining to staff qualifications. Certain requirements from our regulations will not be enforced through this period. And instead, we'll be creating educator policies to help bring more flexibility as you recruit and rebuild the educator workforce that you need to run your programs. Policies will be released later this week and will clarify specific education and work experience that are required for each program setting, including family child care and group and school age EEC programs, and provide simple and clear instructions of what's needed. Programs, we recognize that that the early education and care workforce come from many types of programs and training and preparation. And we want to reflect the experience that they have gained and the knowledge that they have gained along the way. Programs should continue to communicate with their licensors and make sure that they are supported through any staffing challenges. Finally, for those of you who participate in our subsidized childcare system, we're happy to share that many of the same policies that we were working under for the state of emergency will continue through the summer. These policies were designed to provide flexibility for families to navigate COVID-19 health and job-related uncertainties, and will continue to pay based on enrollment instead of attendance, and allow for extended job search flexibility and closure flexibility. We will also continue to waive the collection of parent fees as we wait for the legislature to finalize the FY22 budget. And as well as provide at least 30 days advance notice before we reinstate family fees. The other, for those of you who accept subsidized childcare, we also are continuing to waive the pricing limitation, meaning that programs can continue to offer discounts to private paid tuition as needed, employee discounts and tuition waivers in order to support enrollment. You should have all received an updated communication about our subsidy guidance if you are subsidy administrators last week on June 23rd. And we will be having drop-in sessions to answer questions that were also announced for this week. You can also find them. We'll re-release these later this week in our summary email, and we will continue to host these sessions. If you can't meet the session, please do email us to make sure that we are clarifying your understanding. Finally, we will be reinstating in-person monitoring visits in July, for mid-July. Visits will be announced and scheduled ahead of time at this time through the summer, recognizing that many of you have heightened policies regarding visitors and are just coming back into to post state of emergency operations. If you do have a monitoring visit, your licensor will reach out to schedule it in advance, and they may request certain paperwork or clear some monitoring questions with you so that we can make sure that these visits are as effective as possible. Please know that our licensors will adhere to the health and safety policies that you put in place for your program. If a program is asking that visitors complete a health attestation, for example, then our licensors will be asked to follow your policies and complete that health attestation in alignment with your requirements. We ask to help this process that you communicate with your licensor and explain your policies and ensure that EEC can follow up with the protocols that keep your program safe. I want to note that this holds true for all of our site visitors, not just our licensors, but our grantees and other visitors. We will all follow your policies for your program. Please make sure that you have your policies in writing and ready to communicate to us so we can be respectful and help keep your program healthy and safe throughout this transition period. In addition, we've made some changes to reopening protocols, knowing that many of you have not reopened yet since the March 2020 closures. Please know that you need to reach out to your licensor to touch base and go over expectations. While we won't be requiring reopening transactions, we do want to make sure that you have the support to think through the programmatic adjustments that you may be needed to continue to prevent the transmission of COVID-19. Please note that with the ending of the state of emergency, child care facilities that have not yet reopened will no longer be considered to be closed due to the COVID-19 state of emergency. I want to take a moment now and talk about the success of our recent grant to support workforce and facilities. In March, EEC announced $30 million in grants available to support early education and care providers delivering critical childcare services. These grants leveraged the operational reserve funding that EEC used to target some of the biggest pain points we have been hearing throughout the year. Namely, paying our workforce and retaining them, and understanding the funding for FCC facilities. The allocation included $15 million in facilities grants to family child care providers and $15 million in workforce grants to center-based programs who are accepting subsidy. More information can be found about this on our website. And so I wanted to make sure we're giving you a quick recap. I know we've talked about these a lot. As you know, the money for the workforce grants was directed to center-based providers to ensure that the funding would go to support staff compensation for those who had been working in our childcare programs throughout the year. For family childcare, we have, again, wanting to look at slightly different in that the workforce, family childcare reported spending their own salaries to be able to invest in their facilities and keep their programs healthy and safe. So in response to these two critical needs, we designed these grants to be able to support funding for those programs that have been operating throughout the crisis. We are ecstatic to let you know that 83% of eligible center-based programs and 66% of family childcare programs applied. We learned a lot through this grants process, and you have continued to share critical feedback on the application process, the requirements for documentation, as well as the experience of just accepting these funds. And all this feedback will go to shape our next round and our next investment of funding. So what is ahead for childcare? With the investment from the federal government, there are two federal stimulus packages I wanted to highlight. You may have heard of the CRSA funding that was passed, the stimulus package that was passed in January and provided the state of Massachusetts $131 million. The ARPA, the American Rescue Plan funding, provided two different buckets of funding to Massachusetts. One through our child care pathway, our child care development block grant, and another special stabilization grant funding that is used specifically to fund programs that are in operation and able to stabilize them to be able to continue providing childcare services during this time of unstable revenue. With these two investments from the federal government, we have been working closely with the legislature to ensure appropriation of this funding so that EEC can distribute it to the field. Because of the way that the childcare stabilization dollars through the ARPA funding were set up for us, we were able to find a non-appropriation pathway that will let us deliver these funds to the field in a much quicker and more iterative way. We have heard from you the urgency of receiving these funds and being able to stabilize for the summer so that you are able to continue providing those critical services for families who are returning to work and school. These are very unique funds designed specifically to stabilize childcare operations during this unprecedented period of time. despite the increased operational expenses and the decreased revenue that many of our providers are experiencing. I'll focus on these grants today because the other two will be working closely with the legislature to ensure that appropriation meets both the field and the legislative priorities. For these grants, we will be providing. For these grants, EEC will be piloting the Commonwealth Cares for Children formula through a six-month grants. The federal guidance requires that all licensed and approved programs be eligible for funds. That includes both those programs who have traditionally received subsidies from EEC and those who have not previously received subsidies. Both sets of programs will be eligible for this funding. Please note that this funding does not replace or change any subsidy funding a program already receives. This is a completely separate grant process that will be functioning through our Commonwealth Cares for Children grant. As we learn from this six-month grant, it will help us work with our legislative colleagues to most appropriately plan for distribution of the rest of the funding. So what is this C3 formula that we are piloting? The proposal for the six-month stabilization grants is that we will be giving up to 90% of the total stabilization funding through this process. We'll be distributing 6 monthly payments beginning in July, and we've used an approximate 10% of baseline costs as that for that funding level. The formula itself takes into account staffing costs as well as an equity adjustment that will allow us to be able to respond to the need in vulnerable communities based on the Social Vulnerability Index. As you can see, we have designed this formula to help us understand short and long-term priorities and help us inform the system going forward while we distribute urgent funds to the field. The formula has been developed through conversations with programs originating in our strategic planning last fall and culminating in focus groups and lots of feedback from you all about how we can ensure this pilot is equitable and achieves the goal of stabilizing programs in as simple a way as possible. The amount of each funding for each program is based on the program's licensed capacity, their staffing model, and the needs of the communities and the populations they serve. On July 8th, we will host 2 sessions to walk through these specifics. And please use the QR code at the bottom of the screen or visit the EEC Strategic Engagement portal to register. Please know that this will be an important opportunity to learn from learn about these grants and what you can expect, as well as we'll be working with our key advocacy partners to make sure that they can answer your questions and help be a resource to understand what this means for your program after that date. There will also be many more opportunities for engagement in the months ahead. We are still so focused on our strategic plan that has guided our work for the last year, and we have not strayed from that vision. In fact, it becomes more urgent than ever as we move on to this recovery period. Thank you for all of you who have been using our engagement portal and attending sessions and providing robust feedback that we ask to help shape the future. To date, we've had 38 unique engagement opportunities and over 40,000 visits to our website, including 14,000 unique visitors joining. We continue to refine our approaches and innovate to make sure that your voices are heard in new ways as we develop new initiatives, regulations, and policies, and particularly to make sure that the comprehensive services our communities rely on to serve families and children are getting the robust feedback from those on the ground, not just our childcare providers, but our family and community engagement grantees, our mental health consultation, our school district partners, and all of the robust resources that our communities rely on to make sure that children and families have the resources they need to help them thrive. One of the great new examples of the approach around this engagement has been our Child Care Development our Child Care and Development Fund plan. As you know, by federal law, we are required to submit a state plan every 3 years to receive our child care and development funds from the federal government. It summarizes not only our oversight of child care programs, but also that we are meeting the requirements of the grant. On Monday, we posted our updated plan on our website and engagement portal, and we posted an outline of the changes we've made based on the feedback we received through 2 live engagement sessions we hosted early in June, and the public comment we received. The engagement that EEC facilitated through its strategic action plan since December really helped drive the development of that plan and enabled us to finalize and show the vision we were headed towards. Your response calls for input on particularly how we are integrating our current plan to the long-term supports and vision of our strategic action plan. Thank you again for engaging and providing so much meaningful and actionable feedback. We had more people participate in this plan and feedback than we have in our last plans that we've submitted to the federal government. Over 150 people participated in our engagement sessions, more public comment than we've ever received before. One of our upcoming engagement sessions is scheduled for July 13th and discusses the new approaches to background record checks. We want to make sure that you have an opportunity to inform our operational approach, and it includes how we will be looking at appeals processes going forward. So please do plan to register for that by going to our engagement portal now. I wanted to also share our future of our licensing regulatory structure. On July 12th, we'll be hosting an engagement session focused on this licensing and sharing of the regulatory structure. As you can see, we're looking at separating our regulations by home-based and center-based care, and allowing for the customization that will really make sure that we can be user-oriented and responsive to the unique settings and approaches of programs in our field. Please do join us and help us understand how we can best set up these regulations as a way to ensure that we are responsive and tailoring to the types of environments that are serving our children along the way. There will be many more chances for engagement, and we encourage you to help provide feedback. Send us emails on what you'd like to learn more about. We have so much in the works, and over the next couple months, we'll continue to provide lots of on-the-ground engagement. And as we head into the program year, make sure we are giving you a full and robust update of all of the initiatives that we're working on across our comprehensive strategic action plan that included how our childcare programs fit into the broader community engagement. I know there are probably many questions left unsaid, and so I'm going to turn it over to Eli and start to answer a couple of those questions while we have a few more minutes.
Thank you, Commissioner. There were questions in the chat around the suggested strategies and whether they are still requirements or suggested suggestions. And specifically, we had additional questions about masks in programs and whether health attestations still need to be used. Can you provide some thoughts about that?
Absolutely. So I want to make clear that all of our previous requirements are no longer requirements for our programs. So the mask, the health attestation, those are at the discretion of the program to implement. EEC will no longer be requiring those practices as regulatory practice, but rather suggesting best practices that you may consider putting in place in your program. These suggested strategies include best practices around health and safety, but again, they are not requirements. We know that there are different communities and different needs and parents and families you serve, and we want you to be able to make the decisions for your own programs as to the practices that can help keep you healthy and safe and your families being served during this time. Because of this, any programs should write their own policies based on their own situation into their health and safety policies that govern their program and go through their own required approval processes. Please make sure that you are adequately communicating those to parents in writing and in any other strategies that your parents may need. And EEC will help make sure that you are supported in implementing those policies and ensure that we can help support you with any communications to parents that may arise. Again, programs do not have to do any of these things anymore, but we do want to make sure that you have the flexibility to put those practices in place that make most sense for your programs, your staff, and your families, and to make sure that we are able to support you in implementing your own policies. Programs are encouraged to follow the DPH mask advisory that's currently in place that says that unvaccinated individuals 5 years and older should wear a mask when indoors and unable to distance. But please take these into consideration as you write your own program policies that will govern the health and safety protocols for your facility.
Thank you, Commissioner. That's really helpful. There's additional question around the screening procedures that used to be in place during the state of emergency. For example, if a child has a cough, do they now need to be excluded? Do they need a negative test in order to return?
Of course. So I want to remind everyone that the state epidemiology line does continue to operate. And if you were ever in doubt about what to do in a COVID-related situation, please do call them. Someone will put that in the chat for us so that everyone has that number in writing right in front of them. The Mass Department of Public Health is still recommending that individuals with new symptoms isolate and get tested, and that those identified as close contacts are still required by the local Board of Health and DPH to isolate or quarantine for a period of time. But again, we really hope you will reach out to the epidemiologist at DPH to talk through the specific scenario. They are there to help, and they can ask the very specific health-related questions that will help you make the best decision possible to keep your program healthy and safe.
Thank you, Commissioner. There is a question about COVID-19 testing and whether the resources that the department have put in place are continuing and how that works.
Absolutely. EEC still does have no cost COVID-19 testing around the states, and those sites will continue to be open through the summer. Anyone enrolled in children, family, childcare providers and staff, as well as household members of family childcare, are all eligible for no-cost COVID-19 testing, regardless of symptoms, of vaccination status, and regardless of if you've had a possible exposure to anyone with COVID-19. In addition, we partnered with Neighborhood Villages, a child care advocacy group, to roll out a new program to offer free weekly pooled COVID-19 testing for child care programs throughout the state. Please visit maearlyedtesting.com to be able to sign up and understand where you might be eligible for as we head into the summer and fall.
Wonderful. I think there are questions about the engagement and especially the licensing regulations. How can attendees have a voice in how those are developing?
Absolutely. We really encourage you to join us on July 12th. We are at the initial stages of being able to design the framework for the regulations that will help us make sure that we are designing clear, consistent, and supportive foundation for your program to abide by. So we want to make sure that as we are at this initial stage of thinking through a structure for our new licensing regulations, that we are working with you to understand what the consequences, what the approach, and how this would function for your program. We'll be consistently having engagement opportunities through the summer and fall. So as we take your feedback and continue to populate those regulations, that we are taking in the best practices and the concerns of the field along the way. So we encourage you not only to be engaged on July 12th, but in all of our engagement sessions, that there are, for all of our engagement sessions, including the ones that have happened over the last week, that there are surveys and other opportunities to continue to provide feedback along the way, and make sure that if you can't make the live session, that doesn't mean your voice isn't part of the process. So please do keep checking out our strategic engagement portal and make sure that you are not only looking at the live sessions, but those sessions that have happened of interest to you where you think you might have a voice of how we should be implementing, and ensure you are filling out those surveys and providing us feedback and questions through the commissioner's inbox to make sure we are taking all of that into consideration along the way.
Perfect. Thank you, Commissioner. There's a question around the C3 formula and the grants that I think it bears reiterating what you stated earlier around subsidy and eligibility and how that works.
Absolutely. I'm going to encourage all of you to come and hear far more details on July 8th. There will be a full, robust set of materials next week that you can look at and get to understand the details of this formula in far more nuance. In the meantime, we want to make sure that you know that this program, this funding will not be limited just to providers who have traditionally accepted subsidy. This is funding from the federal government to stabilize operating childcare programs so they can be open and available to families as they are returning to work and returning to school. So we will be working with partners to provide additional support and gather your questions and understand what it is that we need to do to support you in accepting these funds. So while it is eligible to all of our both subsidized and non-subsidized providers, we are limited by the federal government of programs that were licensed to operate or approved to operate on March 11th. So programs that have, we are working with our federal partners to make sure that programs that have become licensed since that date, unfortunately, will not likely be eligible for the funding. So we will be providing far more detail based on the federal guidance on July 8th, and encourage you to come and listen, gather your questions, and help us understand what support you might need as we head into the application. We look forward to continuing to get your feedback and answer your questions on how we can best implement this as we work to open the application process for our programs later in July. So again, I want you to all have this information in writing and to be able to see and hear the details. And so encourage you to join us next week and watch those sessions and plan to hear far more details around eligibility, around the criteria and data used to allocate the funds, and the ways that we hope this will be supporting your programs and being able to stabilize and continue operating throughout the summer and fall, despite despite uncertainties in the landscape.
Thank you so much, Commissioner. I think that is the end of questions for tonight.
Excellent. Thank you. And I'm sorry that we, of course, have lots more, I'm sure lots more questions, but are running out of time tonight, our allocated time tonight. So we will make sure that those questions that are coming in through the commissioner's inbox, that we are looking at them, responding to them, and making sure that we are putting out frequently asked questions that respond to those questions that many of our stakeholders have. I am really so grateful for each and every one of you for taking the time to be with us this evening, and for your ongoing investment and collaboration for this very, very important work of providing supports and care and education to young children and their families. We know that these have been some of the most very challenging times that any of us have experienced, and I recognize how stressful that can be. The EEC team here is here to help facilitate and provide guidance, and we really appreciate your shared commitment to the very important vision of children, youth, and families, and how we can help them reach their full potential. As we settle into the next program year, I wanted to just highlight that, as you all know, we have been grappling with how we accelerate the work of our strategic action plan and ensure that we are supporting the comprehensive needs of children and families across the Commonwealth. Again, this summer, as we settle back into post-state of emergency operations, we hope you'll continue to provide your feedback and your engagement so that we can help build the foundation to grow from over the next year and build towards the strategic vision we all created together right before the pandemic hit. So thank you so much, and looking forward to our continued collaboration, conversation, and work together over the year ahead. Have a great evening.